afternoon, everyone, and welcome to today's webinar, Including People with Disabilities, Public Health, Workforce, and Competencies. I'm Meg Tracy. I'm one of the senior consultants here at the Rural Institute working with the Department of Public Health and Human Services on the Montana Disability and Health Program. There are a variety of programs here at the Rural Institute for inclusive communities at the University of Montana that you'll hear about today. We're very excited with the Rural Institute and those partners and the department to be welcoming Adriane Griffen from the Association of University Centers for Disabilities. AUCD, as it's known by members who exist in every state and territory and are much like the Rural Institute for Inclusive Communities, has worked collaboratively with partners to develop workforce competencies for public health to better include people with disabilities. And this is information we're very excited to share with Dr. Griffen today, with some explicit goals of providing that overview of the competencies and linkages to public health accreditation. We also want to be sharing information with folks on the call and those who will be accessing this webinar in its archived version on local and national resources that public health organizations can access to strengthen their workforce and better include people with disabilities. And an explicit purpose of Dr. Griffen being here in Montana with us is to learn about what our partners are doing in rural America to strengthen public health workforce competencies. And to that end, we hope to facilitate a little bit of a forum for today's webinar participants to share and discuss examples of resources and strategies that are currently being used in rural America. I just want to give a brief introduction to Dr. Griffen, and then I will turn it over to our presenter. Dr. Adriane Griffen serves as the Senior Director for Public Health and Leadership at the Association of University Centers on Disability, or AUCD. She has over 20 years of experience specializing in disability and health, social marketing, qualitative research, and health education. Her activities focus on capacity building, systems change, and health promotion for people with disabilities across the lifespan. We're very excited to have Dr. Griffen with us today. Thank you for being here.
Absolutely. Well, thank you, Dr. Tracy, and welcome, everyone. Just to let you know, I have a few folks here in person, and then the rest of you out there on your computers, in your offices or your home. So welcome to everyone, and I just wanted to also thank my hosts as well. So my version of the learning objectives that Dr. Tracy just shared with you is I really want to just make sure that we have a common understanding of disability and public health. And I am a health educator by training, so we're going to have some interactive quiz questions that I want everyone to use the chat box to participate in. I also want to share our competencies, or that's our short-term hand for the longer title, Including People with Disabilities, Public Health Workforce Competencies. I want to go through those and then talk about ways that disability organizations and public health organizations can really work together and build strategic alliances to incorporate people with disabilities in program planning and efforts. And then we'll wrap up with a call to action where we talk about some specific resources that will benefit you in the rural public health efforts, but also have a little bit of a discussion about ways that you are able to integrate the competencies you've just heard about. So without further ado, I did promise we would do a quiz. So if you look at your screen on the lower right, there's going to be I think it's a lavender-ish color arrow. You can go ahead and get in there. And I am going to just say hi in the chat box so you know that is where I am virtually with you. So first question, and I would love it if you could use that chat box to weigh in and let me know what you think the answers are here. So first one's a multiple choice. What is the percentage of adults with disabilities in the United States? Is it A, 19%, B, 40%, or C, 5%? So This is your chance to weigh in on the chat box here. It looks like I have 15-ish people with me so far, so I'll just give you all a second to find the chat box and weigh in. Looks like folks said A, maybe B. Folks are also still joining the session, so that's terrific. Welcome, everybody. We're just doing some orientation and making sure we're all on the same page with disability and health facts. So for those of you who thought that the answer was A, you're right. We have about 19% of the American population that have some kind of a disability. Now, this is based on some self-report data, and I'm retrieving this from the Census Bureau data from a couple years back, but it is still the current data that we have when we talk about how many Americans are impacted by disability. So for those of you that said, hey, great. Next question, true or false? People with disabilities have an increased risk for chronic disease. Again, please use your chat box on the lower right to open that up to let me know what you think. So I have folks saying true, 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 true. Okay, yeah. People with disabilities are at higher risk, and they have more chronic health conditions than people without disabilities. Right here, I just have a quick snapshot of different chronic conditions that people with disabilities experience at a higher rate than the general public. It impacts things like obesity, as well as blood pressure, cardiovascular issues. So we need to have a common knowledge about the health status of people with disabilities that we're able to frame out and build public health efforts that include them, and be mindful of this in health promotion as well as other health efforts. So that was my purpose in sharing this with all of you. Last opening question, and then I'll get into more content. True or false? People with disabilities may experience, as a group, health disparities. True or false? I see people saying true, true. Just letting other folks weigh in. All right, so thank you for your indulgence with these quiz questions. Yes, people with disabilities do experience health disparities, and like I said a moment ago, so there are different specific disparities around cardiovascular disease. There's also issues around healthcare access and just access to preventive care overall. Also, different issues around being victims of crime, as well as different lower rates of employment. So there are quite a few areas where people with disabilities experience health disparities. So that kind of brings me to why we have these public health workforce competencies. I want to just give you a little bit of background as to how we developed this project. It was really a multi-year effort where we collaborated with a national work group. Some of you on the line in the room here with me were part of those initial work group calls and planning committees, and then we were able to move forward and launch this effort. The competencies are really meant to build foundational knowledge and to be practical for public health practitioners in the workforce right now. It's not really meant to be for initial training efforts for students, although that is something that we hope to do someday. We wanted to target the existing workforce. So if you want to check out the competencies and the companion website, it's disabilityinpublichealth.org. So just moving forward, we launched the competencies in 2016 last year. We also were fortunate to regroup with different advisors and work group members to further disseminate the competencies. And so we're really excited for opportunities like this webinar today to further disseminate the competencies and get them out into the hands of public health practitioners like you on the line. So just a little bit of background about adults with disabilities in the United States. Like I said, we know that, let me go back. I skipped a slide. I clicked too quickly. Let me go back. Here we go. We know, just to emphasize, we know that people with disabilities experience more chronic health conditions than people without disabilities. And another point too, to just remind ourselves of, is that anyone can require a disabling condition within their lifetime. So it just makes good sense if we are serving the entire population to really make sure that we are competent in disability as we serve the whole public. So again, this is a little bit of a repeat of what I said earlier, just reminding us that people with disabilities are at higher risk for poor health outcomes overall. But we know that people with disabilities are a significant portion of the population, so we cannot say that we're serving people with disabilities if we're not truly thinking about the whole community. We know that people with disabilities are our friends, our families, coworkers, neighbors. They're part of every community. So I keep this in mind when talking with different public health practitioners, because oftentimes folks will think that they are serving people with disabilities, but you might not be. So it's important to really ask people in the community how you can better serve them. So a little bit further background on the competencies was that, based on this knowledge around the health disparity areas, we recognized that it's important to make sure the public health workforce has this information. We also did a scan of public health training programs, and we recognized that the large majority, do not even include disability in their curricula. So there aren't current systematic methods for integrating disability into core public health training efforts. So we recognize the need to build a stronger public health workforce and really have that workforce be skilled in ways to include people with disabilities in their current efforts. So that's the goal of the competencies, and kind of just moving in to it, like I said before, we wanted to really target the current workforce, the professionals already working in the field, and have it be practical, have it really be specifically about not only highlighting where the areas of disparities are, but recognizing where there would be opportunities to embed people with disabilities and include them in ongoing health promotion and other efforts. So moving forward here, just wanted to also give a shout out to how these competencies align with other existing public health workforce efforts. We also had the good fortune of collaborating with a few of these entities in creation of the competencies, so I would just want to also acknowledge and thank our other partners there. We're really looking at ways to align these competencies so that we're not adding work to everyone's plate in the public health workforce, but we're really helping people in the workforce work smarter. So these competencies align with the essential public health services. They also align and complement the broader public health competencies for public health professionals, as well as the accreditation criteria. This is something that the Public Health Accreditation Board pulls together. And they also recently put out a new fact sheet on inclusion of people with intellectual disabilities. So there's more work underway, and that just got released last week. So these partners are definitely taking it to the next level as well. We also had the ability to work with the Association of Schools and Programs of Public Health, and they have really been great partners in terms of just putting this forward and making sure that their core competency modules are aligned with this. So just to give you a sense, we tried to make sure that this complements ongoing existing public health efforts. So getting one other area where it complements is, of course, with healthy people. We ultimately want to build the workforce, the public health workforce, and really build capacity of the workforce to know about the disability community and be able to include them in efforts. So getting into the actual competencies and learning objectives, we broke it down into 4 main competencies because we wanted just to make sure that we were giving practitioners in the field a good framework that they could use as a strategy when working with other programs to include people with disabilities. So I'll go through each of the competencies here and the supporting learning objectives, and then I'll get into some more specific action strategies that we embed throughout the competencies, really to show local practitioners how they might do this in their own programs and efforts. So as you can see here, we have 4 competencies. The first one is to discuss disability models across the lifespan. The second is to discuss methods used to assess health issues for people with disabilities. The third is to identify how public health programs impact health outcomes for people with disabilities. And then the fourth one is actually quite a large one. It's around implementing and evaluating strategies to include people with disabilities in public health programs that promote health, prevent disease, and manage chronic and other health conditions. So I'm going to just take a couple minutes next and break down each of these competencies for you and give you a little bit more background on what we mean by each one of them. So for the first competencies, this is around being familiar with different disability models across the lifespan. We chose that language purposefully. Years ago, many people thought that disability was really a pediatric issue, and that people really didn't survive long enough into adulthood to be concerned with disability in long-term public health programming. We know that that is definitely not true and not the case today, and that people with disabilities can live a healthy life through adulthood. So that is one of the key messages in this first learning objective of comparing and contrasting different models of disability. We also go beyond the medical model and get into a little bit more about the social ecological model and the supports for all of the facets of life that keep you healthy. So people with disabilities, just like anyone else, need to also have a supportive environment and those tools to sustain that health. So that's embedded here. The second learning objective is to apply a model of disability for a particular work project or population served. We know that these disability models can really be used as guidelines or tools to think about different disability groups. We also know that the group of people with disabilities is very diverse. So no one model really can describe the disability experience completely. It's a very complex issue. So that's why we have a piece of training here around the different models, so that the public health practitioner who maybe never had any background on disability can look at this section and really get a quick snapshot of the disability population. So that's competency 1. The next competency 2 around methods for assessing health issues. We have 2 different learning objectives under that. The first one is really looking at surveillance systems to capture data that includes people with disabilities. With this learning objective, what we're talking about is making sure that we're embedding measures of disability into existing surveillance efforts. We would just want to make sure that this knowledge is available to help public health professionals with planning programs, or even looking at the existing operations to see who they might be missing. And that actually goes to the second objective here around recognizing that disability can be used as a demographic variable. So just as you might measure and look at gender or age or geographic location, disability can also be a variable in that sense as well. And we feel that that's important for conducting activities, especially ones that might be health promotion efforts that target those areas of health disparity that I talked about earlier. So that's the second competency and what we meant by that. The third competency gets into how public health programs really impact health outcomes for people with disabilities, and we have a few other learning objectives here that I just wanted to go through quickly here. The first one is recognizing health issues of people with disabilities and health promotion strategies that can be used to address them. This really means doing what you do and just making sure that it's adapted for people with disabilities to participate. So we're really talking about people with disabilities having the ability to access health care and any other kind of health promotion effort in their environment without barriers, so that they can receive health interventions and health promotion services just like anyone else in the population. So that leads me to the second learning objective, which is around using laws as a tool to support people with disabilities. We're really fortunate that we have the Americans with Disabilities Act. There's also provisions, around the Rehabilitation Act and the Affordable Care Act to make sure that people with pre-existing conditions get health promotion and healthcare access, just like the general population. So that's what we're referring to here. The third learning objective here is around recognizing accessibility standards and universal design, and these principles to really make sure that we're including people with disabilities. This goes beyond the physical environment. It's not just about having a ramp, it's about having really good health literacy that's accessible to different reading levels. It's about making sure that the culturally competent materials that we develop also are competent for people with disabilities and sensitive to their different needs. So that's what we mean by this learning objective. And the next one here is really around explaining how public health services, government programs, as well as non-government community-based organizations interact with disability. That's part of what I'm hoping we can talk about a little bit later. For this, we're just talking about how public health organizations and professionals really should always be working together. None of this happens in a vacuum, and we know that we need to collaborate to really include people with disabilities in health promotion and planning efforts. So that's what this objective is about. The next one is around describing how communities, and by communities we mean places where we live, work, and recreate, how these communities can adapt and be fully inclusive of different disability populations. Again, this is really making sure that people with disabilities are acknowledged in the community and they're able to receive health interventions and participate in health promotion services just like anyone else in the general population. The last competency here is around implementation and evaluation of strategies to include people with disabilities in programs that generally promote health, prevent disease, and manage chronic and other health conditions. There are, again, quite a few supporting learning objectives here. Really what I wanted to emphasize here is that whenever making an effort around healthcare access or looking at issues around health promotion or chronic disease prevention, it's really important to understand the needs of people with disabilities and partner with them, include them in your planning efforts for these programs. This whole competency and all of these supporting objectives really is meant to help existing public health practitioners have foundational knowledge on how they can better do program planning and health promotion and be inclusive of people with disabilities. So just to review that by these learning objectives, we have one around factors that affect healthcare access. The second one is really looking at strategies to integrate and include people with disabilities in health promotion. The next one is looking at emerging issues that impact people with disabilities. One example of that might be all of the recent climate-related emergency disasters we've been experiencing. It's not sufficient to say just evacuate. You need to have a plan, especially for people with disabilities that might need to have other issues around mobility, medicines, etc., in that plan as well. So that's an example of what we mean by emerging issues. The next one is really thinking more globally about how the environment can impact health outcomes. So that's just not, build a ramp and it's accessible. It's thinking about being culturally competent, mindful of being sensitive to different needs that different disability groups might have, as well as really thinking through the health literacy needs of this group as well. And then the last strategy here is around just thinking through how you measure all of this. We know we need to evaluate what we're doing. So when you are designing and building out these inclusive programs, make sure that you're measuring the good work that you're doing. So that goes to a needs assessment, including people with disabilities in your program design, as well as thinking through process evaluation and program evaluation. Also that you can demonstrate impact of how successful you were in including people with disabilities in your efforts. So I just wanted to throw out a question for the group. How do you think disability organizations can build alliances with public health professionals? And I guess I can also flip that too. How do you think, as public health professionals, you can build alliances with disability organizations toward this intention of including people with disabilities in planning efforts? So this is another opportunity to use the chat box. I know I've been talking at you for a few minutes here. So again, the chat box is on the right bar here, but I guess just if you have any thoughts or key strategy suggestions, please go ahead and use the chat box here, and I'll give you a chance to think about that while I keep going, just for the sake of time here. I do have another fun quiz for us, which also uses the right chat box here. So the quiz question here I have is another multiple choice. The question is, what is one of the most effective ways to begin including people with disabilities in planning? Is it A, identifying partnerships, B, asking colleagues, or C, invite people with disabilities to an event? And I see someone talked about a strategy of inviting people with disabilities to the table for planning. That is a great idea in terms of building strategic alliances here. Looks like some folks said for this option that the most effective way might be C, inviting people, or maybe it's A, identifying partners, or oh yeah, maybe it's all of the above. It is a trick question. It is all of the above. So thank you for participating and showing me that you're still with me here. I really just wanted to take a minute to go through how important partnerships are in implementing these workforce competencies. It's really important to identify who your partners are that you can go to for any kind of knowledge that you might not have already, or any kind of network that you might not have access to already. And it's important to connect with those partners and make sure that you're all on the same page with the intention of what you want to do, and then in an ongoing way engage and support those partners. So all of the above is what I was looking for here. The other thing I wanted to do next was share with you just some key strategies that we have embedded throughout the competencies. We have these woven into the different competencies and learning objectives that I just shared with you. And we do that to really try to make it real for you, so that it's not just a didactic set of learning competencies that you read in a book, but really something that you integrate into your day-to-day. So again, this is also something that you can weigh in on via the chat box here. One strategy that we recommend in the competencies is identifying key as well as non-traditional partners at different levels. So that might be a more regional or local group, or it could be a group such as AUCD, the national presence, that we might have a state partner. So what are some organizations and groups that you think you could partner with in order to take these workforce competencies and really embed them into your work? Just give me some examples, if you don't mind, using that good old chat box here on the right. Thoughts on that? And then you could also let me know, what are some of your non-traditional partnerships in terms of including people with disabilities in your public health efforts? So I'll just pause here and give you a chance to go ahead and chat in some examples or some ideas you might have around organizations or groups that you could partner with. So I see folks are starting to weigh in, planners, engineers, public works, education. These are all really good examples of good partners to include as you are working toward making sure that people with disabilities are part of ongoing public health efforts. City government, that's another great example. Yeah, so this is just a way for you to be thinking about who do you not have at the table, who could be at the table to really help you do your work and be more inclusive of people with disabilities. So the other strategy that I just wanted to emphasize to you is really to connect with others and build out your network. We really want to make sure that you're reaching out to clinics in your community. We know we have a lot of local health departments on with us today, making sure that you're making contact in your community. So it's really important to do that. I see someone else also in the chat box weighed in and said faith communities are another local partner. So that would be a great example of reaching out in your community as well. And it's important to ask about their partners and their resources so that you can widen your network and widen your circle. And it's also really important to not forget to include people with disabilities and talk with people with disabilities as well as their caregivers. Make sure that they're part of this conversation as well. One thing I did want to just mention, throughout the workforce competencies, we include what we call action examples. And so one of the action examples that we talk about comes from the Disability and Health Program of Iowa. They actually partnered with their Department of Health and did a pilot in one county, in Polk County actually is where this took place. They partnered with their emergency management team just to evaluate and assess disaster shelters to make sure that they were ADA accessibility compliant. So that was very important, and it got to a county level government implementation that really helped emergency shelters across the state. And the Disability and Health Program in Iowa actually continues to partner with these organizations and government entities to do other health promotion efforts for people with disabilities. So I just offer that up as one particular example. So if you are to pick up the competencies and read them in more detail, you'll see action examples like that throughout. Let me just keep going here. I wanted to share a little bit more on specific strategies. We know that many of you are also in charge of doing things like standing up a heart health event or maybe a diabetes screening event or a blood pressure check. And we wanted to recognize that a great strategy for integrating people with disabilities is to really engage those community partners in charge of lifestyle changes and supports and invite them to work with you, and also invite them to include people with disabilities in planning those events and serving as speakers or discussants at those events. It really helps to share lessons learned and really as an example to show where the other partners are engaged and stay connected. So another action example I wanted to just highlight for you is that the National Association of County and City Health Officials, or NACCHO, they developed strategies for successfully including people with disabilities in health department programs, plans, and services. And then they disseminated it to local health departments across the country. And now this is an ongoing resource that really also provides a nice, really quick disability inclusion checklist, if you will, with other strategies that local health departments can use to incorporate people with disabilities in health promotion programming. And what I like about it is that it really is a good effort that showcases how a national organization can bring in local entities across the country and encourage partnering. And that's what we're trying to do here. So these action examples I've mentioned, they're embedded throughout. They're really little vignettes or stories, if you will, to kind of help you think through how would I implement these strategies in my efforts. So with that, I wanted to also just acknowledge some national partners who have been so helpful to us getting these competencies off the ground and implemented. So I did just mention NACHO, the National Association of County and City Health Organizations. They invited us last year to do a training session at their conference, and they also just released some really nice disability training modules for local health departments. We also recently did a presentation to the National Association of Chronic Disease Directors on these competencies, and we hope to be collaborating on more in a more ongoing way with their efforts as well. So those were key partners so far. The other partner I wanted to acknowledge and give a shout out to is the Association of Teachers of Maternal and Child Health. We were able to collaborate with them. We applied for what they call an Innovative Teaching Award, and that enabled us to take these competencies and do an online training module with some sample syllabi that you can go to the website and download and integrate into other trainings that you might need content for or want to enhance content around. So those are resources that are available to you as well. And then we also have been collaborating with the Maternal Child Health Bureau. They were really fantastic advisory group members, and then they've been highlighting the competencies in their research alerts, and we hope to do further collaboration with them in the future. So those were some national partners. And then I also wanted to give a shout out to the Public Health Foundation. We've been working with them around the idea of doing some possible future training that would carry some continuing education credits. So more to come on that. One other example I wanted to highlight for you is that the University of Colorado, we have a university center present there through the AUCD network. They actually use the competencies to do a training of the National Jewish Health Quit Line workers. People with disabilities tend to smoke about 50% more than the general population, yet the Quit Line wasn't doing disability training. So we recognized that need and approached them and basically just said, we could come do a training for you if you would integrate that into your ongoing efforts. And we were able to collaborate with them and get that integrated. So that's just one example of how a local center collaborated around this particular health disparity and integrated these competencies into ongoing efforts. And so for that training of the smoking quit line workers, that training really focused on disability overall, person first language, as well as disability etiquette, and how to incorporate and include people with disabilities in health promotion. So other partners I just didn't want to forget, APHA, the American Public Health Association, has been so helpful, especially the disability section. And then we're also working with the Council on Linkages to try to embed work there, and the CDC's Continuing Education Office. So all of those efforts have kind of come together to help get these competencies out. So your call to action, really want to have discussion now and hear from you, and perhaps we could use the chat box for this. We really wanted to emphasize that we hope that you take these competencies and partner with disability and health professionals to really help include people with disabilities in public health program planning and design. And specifically, we wanted to talk a little bit more about how you do this. Reaching out, of course, to public health professionals, local health departments and clinics, making those connections is so important. I talked a little bit about being creative with those partners that you engage, thinking about non-traditional partners, and creating training opportunities and learning opportunities. Sometimes it's important to piggyback on things that are already out there and make sure that they are including people with disabilities. So really, we hope that the competencies are a resource for different examples, and those training modules I mentioned a few moments ago are resources available to you on that website. So I wanted to ask the group around this call for action, where do you think are your openings to include people with disabilities in your work? And you can use the chat box here. to weigh in on that. And I guess another way of asking that, beyond where you think the openings are, where do you think that you need to include people with disabilities? Where do you think there might be gaps? So this is your opportunity to use that right-hand chat box in the lower right and let me know where you think your openings are to include people with disabilities, or where you think you need to include people with disabilities specifically. And it looks like we have a few folks still on with us. So asking people with disabilities to help improve your website. Yeah, that's an excellent example, and that gets back to making sure that your information is really accessible, that you're thinking about all of the health literacy principles. That's important. Oh, another one's around reviewing materials for dissemination. That's important too. I could think that would be important in a couple different ways. One might be around just the accessibility of the language, but then also thinking about the target groups who you're going to involve in that dissemination loop. So that's a really good example. So the purpose of my asking that was really for you to think about how you might, be creative and think about where you can embed this information in your ongoing efforts. So if you have any other thoughts, please feel free to use the chat box here. I do want to move on, though. We have a couple other ways to keep in touch with each other. This is the website I mentioned at the beginning. I did mention some other e-learning modules and resources with the action strategy example. So it's disabilityandpublichealth.org is the website that I was referring to earlier. We have really just wanted to highlight for you that I am part of the Association of University Centers on Disabilities, and we have a national network. We have a presence in every state and every territory, and we would love it if you would partner with the center closest to you. So if you are interested in pursuing other partners, or you're not already partnering with your state or territorial AUCD network member, please go to our website. It's aucd.org and check out the center nearest you. We would really be able to enhance the work you're doing around disability inclusion and just be able to partner and support you in your efforts and really help you know that you're not alone. You're in good company in doing this work. Again, just knowing that you have a community supporting you in this work. We have a Twitter handle at Public Health is for Everyone, and we also use the hashtag DisabilityInPH. We also are just forming a LinkedIn group here, including people with disabilities, public health workforce competencies. Again, this is really just a way for you to know you're not alone, for public health professionals and other disability and health professionals to have a forum to check in with each other, maybe share tips or strategies that have been effective, or even ones that have not been effective, so that you know what not to do. So we're just getting that started, so check that out if you're on LinkedIn. The other resource I wanted to share with you is our Public Health is for Everyone online toolkit. This is really meant to be a really comprehensive resource for public health practitioners in the field, and that URL is www.phetoolkit.org. And again, it's just meant to really showcase the different guides, fact sheets, checklists that we already know that are out and have been effective in terms of meeting the needs of people with disabilities. And I know that some of you joining us today also have resources to share, so I wanted to showcase that for you. We would love for you to share your resources, and that's easy to do if you go to our homepage and check out the upper right orange bar that says share your resources. We would love to know what's working well for you and tools your organizations have shared. I did also want to just pause here and go through some other local resources, or I guess some resources that are in the area of rural health, because I know that that would be really helpful for many of you on this particular webinar. But I do also want to just throw out a question for the group here. How have you worked with partners to enhance the workforce? just if you could use the chat box, just let me know how you have used, what have you done to work with partners to enhance workforce capacity. Any thoughts around that before I get into these resources? And I'm also curious to know if you have examples of programs or examples of any other collaborations you've done that have included people with disabilities. So all of that would be helpful to share if you have that at your fingertips and you're able to use that chat box on the right. That would be great. Otherwise, I will just keep going here. We have a number of different resources that I would really encourage you to connect with. They've been developed in collaboration with the RTC Rural, and that stands for Research and Training Center on Disability in Rural Communities. There are a number of really great resources that take what we just talked about to the next level and really also give you some excellent background information on disability and the information that you would need to perhaps target and develop more programming in your area. So the couple that I wanted to just make sure that everyone on this webinar knew about were around the Disability Counts Data Finder. This is a really super neat way to look at the disability status and rural status of any county. The other one is around just how rural is defined, and this resource goes through different definitions. I found that really helpful, and I thought you might too when you're explaining this to other partners. Just other good resources that I thought would be good for public health and local health departments to know about. There's a really nice Disability in America map series that really goes through how disability is a demographic and is just as important as age or income or gender or the other socioeconomic factors. There's also a nice Living and Working Well with a Disability program. What's nice about this is that it's evidence-based and it's peer-led so that people with disabilities are part of the effort. If you haven't picked up on that already, I believe that people with disabilities should be at the table in programming and planning your inclusive health efforts. So this gives a nice example of ways to do that and other groups that you can partner with. The next resource I just wanted to highlight for all of you is Advocacy Skill Building Toolkit. This is really important in terms of making sure that people with disabilities can be leaders in this work and that you're really helping to make them more sophisticated advocates for themselves. So that's a really great set of tools. The next one I just wanted to highlight real quick is around options at discharge in rural settings. And this program is really around, what do you do when you are discharged and you're in a rural area and you maybe need some ongoing outpatient services back home in your small town or rural community. So I would invite you to check that out as well. I think that's another excellent tool. So the RTC Rural also has a nice newsletter that you can sign up for. I have the URL here. I might just pop that into the chat box. I can't copy that. We will make sure that you have that, and you're all going to get these slides here as well. There's also a neat Facebook page and a Twitter feed. So if you're on social media at all, check those out so you can stay in touch with each other. So again, I think that you can gain a lot from being in touch with each other and looking at what's already out in the world so that you're not recreating the wheel. So that was my purpose in sharing all of those resources with you. I wanted to also let you know that we have an email address. You can feel free to contact me if you have any other questions, or we have a general disability and public health email address. It's disabilityandph@aucd.org that we also check out. Again, the website for the competencies is disabilityandpublichealth.org. And then if you were specifically interested in the learning modules I mentioned, I have the link here for those as well. Really right now, I wanted to open it up to your questions. And I wanted to also start with a question for you. What local or regional partners come to mind when you think about incorporating and integrating these competencies into your work? Are there any other local or regional partners that you think, wow, we really need to get them involved? If you could use the chat box on the right, that would be great. Meg Tracy, yeah, well, she's here, she's gonna be involved. But to your point, I think that was Karen who weighed in, you do need to be thinking about partnering with the state representatives who are part of the Disability and Health Program and part of the local centers of the AUCD network. So I think that Meg is a good representative of both. So thank you for weighing in. What other local or regional partners came into your mind when you were thinking about how you would really integrate these competencies into your work? Other thoughts on that? I think to your point about mentioning Meg specifically by name, a lot of it does come down to relationship building and enhancing your relationships with partners so that you can call on them for future opportunities, so that you have that connection already fostered, so that if you have something new to go after, you at least already know the person you're making that ask of. So knowing a person by name, not just their organization, that's really important, and I would say critical as well. I'm reading into your comment there, Karen, but wanted to also make that point too.
This is Meg Tracy, and I am reading into your comment, Karen, just to emphasize some of the partners who are on the webinar today. If you're a public health partner on the call today, you may or may not have a relationship with your Center for Independent Living, with Special Olympics. You may or may not have a relationship with a developmental disabilities provider in your community. And if you don't, we're certainly happy to do introductions. But really just starting with building those relationships is really going to be important. So I sit here at the University Center for Excellence for Montana. We exist in every state, these USEDs, and so I can do that matchmaking, and other USEDs can as well. And we're happy to make those introductions, and really are excited to hear what happens through those partnerships at local levels, and in our role be able to share those across communities in our state and nationally through AUCD. We also have, I do want to mention that our role as a USID is to leverage the resources of the university to issues communities are trying to solve these partnerships. So it's not just the folks here at our USID, but it's folks across campus and campuses here in Montana and similar systems that USEDs connect through other states. So we're able to do matchmaking at the local level, and then if issues are identified that we can help with through the roles of the university, research, development, training, education, we really are interested in hearing about those, and happy to play that role.
And this is Adriane again, I did also want to mention too that another facet of the AUCD family, or what we call our lens, or leadership and education and neurodevelopmental disabilities, and these are training programs also throughout the country, and one of the disciplines that they emphasize is public health. So that would also be another excellent resource for you at a state level to reach out to, just to make sure that you're connected with the latest and greatest in terms of disability and health. And they may also be able to sit with you and get you up to speed on anything that you might need in a quick, succinct way. So LENS, L-E-N-D-S, that's another acronym you might hear in working with the AUCD network.
The other mention I'll have is just that we've been really working hard at this in Montana with the Department of Public Health and Human Services, and there are a lot of model training and policy efforts within the department that we're really hoping to be promoting to partners across the state and or out of state through the Montana Disability and Health Program. So this webinar is an example of something we really wanted to organize with our partners. And we have a few other webinars that I'll make sure to include when we disseminate information about the archived version of this webinar. And if you want more information, I'm happy to connect you back to our key partners within the department so they can be sharing information with you as well. I do want to emphasize, while we have the time, some of the vignettes that Dr. Griffen was sharing from other states. We have similar vignettes here, and so I'm happy to share those examples of things that have worked. And one that I'll mention specifically, since October is both Disability Employment Awareness Month as well as Breast Cancer Awareness Month, is that we work really hard through the Montana Cancer Coalition and our partners through Centers for Independent Living and Komen and mammography centers statewide to move those preventative screenings for breast health to being more inclusive. And so I'm sitting here with Helen Rousset, who's a doctoral student in public health, and she's just finishing up our action plans with some of the new centers in the state, but we'll be sharing the updated version of what's called the Montana Mammography Directory, and that reflects access information for mammography that's inclusive of what people with disabilities want to know as they schedule their mammograms, not just what the hours are, whether there's any kinds of financing or support for mammography, whether what types of services are available there, but also whether or not what they need to ask for in terms of making that service accessible to them when they call and schedule their appointment. They can see that they might need to ask for that accessible exam room or for that accessible machine. So we'll be sharing that as well, and that's something we're really proud of in terms of that collaboration that is represented through this diverse partnership.
And I did also just want to add the project that Dr. Tracy just mentioned. I know that there are some spin-off companion supporting tools from that project that we have highlighted in the Public Health is for Everyone toolkit that I mentioned a few minutes ago. And so that's a really great example of a state effort that has really brought to light some guidelines and really a framework that can be shared with other states across the country. So the AUCD network really tries to help bring those lessons learned to light and share it with other states so that no one's working in a vacuum or worse yet, recreating the wheel. We all know that resources and time are very precious, and we want to make sure that we're sharing all of those great lessons learned. So I just wanted to give a shout out to the effort that Dr. Tracy just mentioned.
Thanks. And I also want to mention there's lots of examples from our county health departments that we're hoping to organize and promote. We've got success stories on some of them, and we have those on our website. And I'll just include a link to those in our follow-up dissemination. As part of employment, I think Dr. Griffen and I were talking today, just as a key strategy for building your workforce competencies is really looking at your outreach to future employees who may have disabilities. And Catherine Nipson is here. She's one of our national experts in including people with disabilities in workforce. And I encourage you to look at some of the tools that are available to you as an organization to really become more inclusive as a workplace.
Yeah, thank you for bringing that up, because that's such an important link. You need to be healthy and well enough to work, but then we know that if you are working, especially as an individual with a disability, you tend to be healthier, and there's a huge connection and anything that we can do to enhance the number of people with disabilities in the workforce will at the same time be enhancing the number of people living well with disability. So that's really, really an important and critical linkage. So thank you for bringing that up.
Yeah. Any final comments in the chat box? We'll just hold on for a few seconds here.
I see thank yous popping up.
Okay. If not, we're going to end our recording. This webinar will be made available in an archived version with the captions, and we'll also include in our dissemination slide set of these slides in an accessible version. We really appreciate everybody being on the call, and thank you, Dr. Griffen, for joining us here in Missoula at the University of Montana.
Oh, thanks for having me.
Okay. Bye, everybody.